about your normal heart rate. Now, think about your heart rate when you're really stressed. Hear the difference? It's much faster and less variable, closer to a metronome. Research has consistently linked heart rate to stress and anxiety levels. As one increases, so does the other. With the onset of the COVID pandemic, stress levels have indeed been rising. The effects were immediate. According to the AEI, the likelihood of experiencing mental distress, anxiety, or depression increased threefold from 2019 to the spring of 2020, and it has only continued to skyrocket. The pandemic has also exposed the inequities that are pervasive throughout the healthcare system. Even during normal times, traditional clinic-based services are inaccessible to many people with mental health problems, especially those from disadvantaged backgrounds. High costs, long waiting lists, and professional shortages are only a few of the challenges associated. If we are to substantially reduce the burden of mental illness and increase equity in access to services, we need to develop better models of mental health care. Digital mobile technologies are particularly efficient and advantageous in health promotion, prevention, early intervention, and prolonged treatment. It is time to use these technologies to start to build a more responsive and efficient mental health care system. Nowhere did we draw as much inspiration as from our own community. In our original outreach survey, over 40% of people reported struggling with mental health, and a majority of them felt uncertain about what caused it. A similarly large amount said that quarantine had negatively impacted their mental health. These people around us need and deserve help, and that's where our app Fizzy comes in. It promotes individualized at-home activities, supported by research to target the major causes of stress and anxiety across the board. It tracks data on physiological cues such as heart rate to narrow down what will help you the most, and it will always remain free and accessible to all. It also includes links to external mental health care resources. After getting the inspiration for Fizzy, our original goal was to go straight into development after iterating through a few prototypes. However, the actual cycle ended up being a little more complex than we had expected. We went through the process of teaching ourselves a whole new language and platform, only to have it fail when it came to the integrations that were necessary to make the app work. Persevering through challenges such as these and adapting to new platforms while incorporating feedback from both community members and professionals were ultimately key to us growing together as a successful team. We were each able to build our skills and contribute to coding the app, and we will continue to work to make our ideas a reality by fully developing versions to support both Android and iOS devices, and eventually launch Fizzy to both the App Store and Google Play Store so that it can have the greatest impact possible. In the future, we'd like to introduce features such as heart rate variability monitoring, user input to verify mental health levels, and integration of professional mental health services to further help our users. Our goals have been markedly impacted by our work on this idea, and after releasing the app, we hope to add to the necessary conversation surrounding mental health advocacy and fight the stigma that often surrounds it. In the end, our ultimate goal is to improve access to mental health services that are individualized, accessible, and data-driven. During these times more than ever, increasing equity through innovative technology will play a central role in ensuring a sustainable health future, which Team Fizzy is here to contribute to. Thank you for watching. We hope you have a wonderful day.